So the next section will, in the next section, we will be happy to have a representative from the Hospital Authority Employees Alliance to make his speech.
So this is a statement from the Hospital Authority Employee Alliance. It has been reported that there is a very dire situation facing frontline medics. Most of us know that the Wuhan coronavirus has left people dropping dead on the streets, that the entire system in Wuhan healthcare system is insufficient to support and to cope with the ongoing coronavirus crisis. Meanwhile, in Hong Kong, the frontline medics are ill-equipped with the ability to cope with this crisis. The masks and personal protective equipment are in shortage or restricted supply. Some of the personal protective equipment are not up to the standard necessary for dealing with suspected or confirmed cases of the new coronavirus, as demonstrated earlier in the comparison between blue and yellow PPEs. Some of the medics have reported that expired masks are still in use. Some of the negative pressure isolation wards are not up to the required standards. Even if defective equipment were to be used in those wards, the number of negative pressure wards will soon be at full patient capacity anyways. Some frontline hospital medics have had isolation ward shifts imposed on them, contrary to the Director of Quality and Safety statement that all arrangements will be voluntary. The so-called picking of lots for life and death have been made for them, and this is a curious statement to be made by this director. The Alliance therefore has 5 demands. The Alliance urges the Hospital Authority to make a public statement to the government with the following 2 demands. 1, to restrict any visitors arriving from China, and 2, to encourage all citizens to wear masks. The other 3 demands for the Hospital Authority from the Alliance is 1, provide a sufficient number of isolation wards and suspend non-emergency services. 2, implement strict follow-up measures to patients escaping and providing false medical history to ensure a safe working environment. And 3, providing enough protection equipment to frontline medics to ensure their personal safety. If the Hospital Authority fails to respond to the Alliance's 5 demands above by tonight, the Alliance will place a motion for industrial action on the 1st of February. The Alliance proposes a 2-phase strike starting from February 3rd and lasting 5 days. The first phase will be to suspend non-emergency services in hospitals. This phase will last for 1 day. If the Hospital Authority does not propose comprehensive measures to address the Alliance's demands by midnight of 4th of February, the Alliance will commence the 2nd phase of the strike. The 2nd phase will be a general strike, meaning that all services will be affected, and the Hospital Authority can only provide limited emergency services. This phase will last for 4 days. If the Hospital Authority still insists on ignoring the demands, the Alliance will consider further escalation. It is only when they commence the strike action under the Alliance will that mean that they have sufficient bargaining chip in negotiations with the Hospital Authority. The Alliance can also consolidate and estimate the numbers and effectiveness of the strike action. When they're striking under a union, employers cannot simply fire employees participating in strike action. If they are unfortunately fired, the Alliance can represent employees and sue employers under the Hong Kong Federation of Trade Union Ordinance. The Alliance will also protect those employees for other actions, such as supporting them through union funds. The Alliance has also made a strike declaration. The strike declaration refers to Alliance members committing their names to agree to participate in the strike. The purpose of this is to allow the Alliance to have a better estimation of the number of medics going on strike, to see if they should go forward with the strike in the end. The declaration will collect all relevant information of Alliance members going on strike, including their names, departments, and ranks. In particular, the Alliance will reflect the department and ranks of the people who are going on strike to the Hospital Authority so that they can make according human resources arrangements to resume services as soon as possible. The Alliance will also discuss whether the names are to be disclosed to the Hospital Authority at the later meeting on the 1st of February.